Hi, I'm here to present some research findings on the comparative effectiveness of SSRIs and cognitive behavioral therapy at treating teenage generalized anxiety disorder. Generalized anxiety disorder is an anxiety disorder characterized by persistent and excessive worry. This has to do with worries that are unwanted and uncontrollable that you have real difficulty controlling. Symptoms of generalized anxiety, or GAD, include increased heart rate, rapid breathing, sweating or trembling, tiredness or weakness, trouble sleeping, gastrointestinal problems, nervousness, irritability, and or a sense of being on edge, a sense of impending danger, panic or doom, and lastly, difficulty concentrating. A survey done about a decade ago found that 2.2% of American youth fit the criteria, the diagnostic criteria for generalized anxiety disorder. As for the methodology of this, the research question we posed was how effective at treating teenagers' generalized anxiety disorder is cognitive behavioral therapy compared to SSRIs. So this research was formatted using the PICO research tool, which is a quantitative method of research that was originally designed for medical interventions for testing the comparative quantitative effectiveness of medicinal interventions. We thought that would be most fitting since we were considering the clinical effectiveness of two treatment regimes. We consulted only Gray literature, which had been peer-reviewed and published after 2013, and this was accessed using Centennial Library and or Google Scholar. 5 publications in total were consulted. Our findings were that there are no side effects, no reported side effects to using cognitive behavioral therapy, whereas there are various side effects of taking SSRIs depending on which is taken, including but not limited to suicidal ideation, nausea, abdominal pain, and vomiting. And that's from a study published by Bezito, Baum et al. In 2015. It was found that combination therapy is more effective than either option on its own. However, both options were found to be more effective than placebo. Cognitive behavioral therapy was found to be between 60 and 79% effective at youth in this age range, while SSRIs were found to be between 36.4 and 55% effective. So there's a slight marginal, depending on what you say, consider marginal, gain in effectiveness in using cognitive behavioral therapy instead of SSRIs. It was found that CBT, however, is no more effective than any other active therapy modality, which would include something like psychoanalysis, other forms of talk therapy, as well as self-help books, spiritual counseling, going to confession, those sorts of things. We do have some methodological stipulations about these findings. Most of this research was conducted over 10 years ago. Most of the research consulted in this study was review of earlier research. Most of the research that was done on the comparative effectiveness was done well beyond the 2013 cap as stipulated by the assignment. So it's not fresh, it's not up to date. And most of the literature we found, most of the quality literature was reviewing earlier studies. And they didn't always go into a lot of detail. A good deal of the research was also too broad to answer my specific question, meaning they studied its effectiveness on children and adolescents without specifying or narrowing down to just that adolescent age range. And we again and again encountered poor experimental design to the point where we had to disregard 2 papers because they just were not scientifically credible for methodological reasons. For instance, not specifying which psychoactive drugs were used, just saying psychoactive drugs versus cognitive behavioral therapy with no further specification. In conclusion, the research suggests that CBT is slightly more effective than SSRIs are at treating teenagers' generalized anxiety disorder. Cognitive behavioral therapy has none of the many side effects of SSRIs, some of which are incredibly dangerous, right? Suicidal ideation, of course, being very dangerous. And a bigger methodological takeaway is just because an article is published in a peer-reviewed medical journal does not assure its rigor. And so I ask my fellow researchers to pursue these questions more in the future. Thank you for your time. You'll now see my sources. Thank you.